Order! Order! You are an incorrigible delinquent at times. Behave yourself, man!
NHS trusts in England are being accused of putting mental health patients at risk because of measures to cut costs. Our health correspondent Nick Triggle can tell us more. The report today from whom and what does it say?
It's from the King's Fund, and I suppose the first thing to say is just how common mental health problems are. 1 in 4 of us will suffer a mental health problem each year. Now that can range from conditions such as depression and anxiety through to more serious conditions like schizophrenia. And that's why the report says it's so important the NHS gets care right, but it seems it isn't. The report says there's widespread evidence of poor care, and they're linking this to cuts in services. More than 4 in 10 trusts have seen their income drop in the past year, and they've responded by moving to more unproven, untested treatments, cheaper ones, and this has included merging specialist teams into generic ones in the community and increasingly relying on volunteers and support staff instead of doctors and nurses. Meanwhile, the number of hospital beds has dropped. Now, the report acknowledges this is part of a wider NHS drive to move care out of hospitals and into the community. But they say in mental health, that's happened too quickly and on too grand a scale.
And what do the government say?
Well, the government says it's investing in mental health. The actual overall budget increased last year to 11.7 billion. That's about a tenth of the overall spend on the NHS. But it seems that not all of that is getting through to the mental health trusts. Now, there could be a number of reasons for that. The private sector and the voluntary sector also get involved in providing services in mental health. But it may also be the case that with money so tight in the health service, health bosses are using the mental health funds to plug gaps elsewhere. Now, the government has said they want to stop that. They want to see parity of esteem between mental health and physical health. That essentially means treating them as the same. And to ensure that happens, they're introducing waiting time targets. So for people who need access to talking therapies, they should be seen within 18 weeks. And for those that are experiencing their first episode of psychosis, they should get help within 2 weeks. And that mirrors what's been in place for years in terms of hip and knee replacements and cancer care.
OK. Thank you very much, Nick. Thank you. Let's hear from Kate, who says that the NHS dealt with her dad really badly on a couple of occasions when he was self-harming and feeling suicidal. Kate isn't her real name, as she's asked to remain anonymous. She's been speaking to our health correspondent, Sophie Hutchinson.
The reality was they just couldn't find him a bed, and they were doing everything they could, but they had to just keep saying to us, we can't find a bed. So we had to, as far as possible, look after Dad within the home with Mum. On the Friday, we were told, if you need help out of hours, phone the crisis number. We know we shouldn't be leaving you at 5 p.m. this Friday because of the situation, but that is the reality. That night, he was very difficult, and then it reached a stage where my mum had to phone an ambulance. She couldn't keep him safe. And when the ambulance came out, we were taken to a cafe, which was meant to be a place where people could, out of hours, go and talk about how they were feeling. But we're talking about a man who was acutely suicidal in an ambulance, to the extent that the ambulance staff didn't feel it was safe or appropriate to take him into the cafe while there wasn't a member of staff to speak to him. And so my husband and my mum and my dad were outside this cafe 11 o'clock at night in this ambulance, waiting to see if somebody could come out and could see Dad. And then after 50 minutes, there was still nobody to talk to him, and so the ambulance crew made the decision, right, we're going back to A&E, we're going to A&E, which is not helpful for anybody involved. It's very difficult for A&E staff to manage somebody so acutely ill, and all services knew that wasn't where my dad needed to be, but there was no choice.
That was Kate. Let's talk now to Kerry, who's experienced psychosis and says her access to services has been poor, and also Claire Murdoch, who is the Chief Executive of the Central and North West London NHS Trust and also chairs the Cavendish Square Group. They represent London's 10 NHS mental health trusts. Welcome to both of you. Kerry, first of all, you went to A&E to try to get yourself admitted. Tell us what happened.
So a few years ago, after some really difficult things in my life, I became really seriously ill. I was frightened, very miserable, very confused, and hearing voices. And so I knew that I was just getting worse and worse, and there came a point where I didn't feel I could keep myself safe. So I ended up going to A&E and saying, I can't keep myself safe, please can I be in hospital? And they said, well, you can't because there aren't any beds. And I got sent home, and then 2 days later then I tried to set myself on fire. Luckily that didn't work, but I was sent to hospital against my will. But again, I had to wait about 9 hours in A&E, and there were no NHS beds in the northeast of England at the time at all. So I was sent to a private hospital some distance away from where I lived. And that was frightening and confusing because my friends and family couldn't come and visit me as easily. And even since that's happened, then there's been more bed closures. I mean, since that time, there's been 32 bed closures in my local area.
Right. And Claire Murdoch, this is Kerry's story, is an illustration of some of the things that this independent report is suggesting today. Do you recognise the picture it's painting?
Well, first of all, I'd like to say I really welcome the report, because I think what we all recognise is the immense amount of pressure that services are under. When that pressure manifests so that decisions about whether to admit someone or not, whether there's a bed available, you know, are compromised, then things are very, very wrong. We shouldn't be waiting until we have to section someone, detain someone against their will, when just a few days earlier they were happy to come forward and ask for help, and you know, a whole different experience could have followed. So there's a lot in the report that I do recognise. And I guess the key thing I would like to say is, whilst it's not all about money, some of our poorer funded services deliver brilliant care. It's this patchwork of service delivery. It's the postcode lottery, the variation.
But isn't that a decision down to the local NHS trust, in effect? What the government say, and you tell me if you buy what they say, is, look, we're distributing the money to all the NHS trusts in England. If they're not pushing that into the right areas, how can that be the government's fault?
Two things. One, yes, there's some extra money available this year for mental health services targeted against certain services. That's against a backdrop of year-on-year decrease. So it's really welcome, but it's probably too little, and it's against real pressure against core services over recent years. The second thing is the money doesn't come directly to trusts. It goes through several hands before it reaches trusts. Some commissioners, the hands it goes through, have passed on that money in total. Many have passed some of that money on. Some commissioners have said they've got such pressures elsewhere, and the typical ones will be the acute hospitals, the A&E departments, the general culprits that we come second best to always. Some areas have said some of that money has to be siphoned off to support even bigger pressures elsewhere. We would say in the Cavendish Square Group that's unacceptable. I have heard through my collaborative networks nationally that there are some areas, some trusts, that haven't seen any of that money.
Wow. Well, what impact is that going to have on people like Kerry and other patients?
If I can come back to that point, I've been doing a lot of campaigning about bed cuts and so forth in the last few years. I've talked to everyone from the Deputy Prime Minister on down, and no one
the then Deputy Prime Minister,
and no one seems to take responsibility for saying this is the money and this is how it can be spent. So, you know, the government announces all these grand initiatives, but then the money goes through all sorts of acronyms like Monitor and the CCGs and commissioners, and as she was saying,
commissioning groups,
yes.
But their argument there is, you probably know, Kerry, and you will definitely know, Claire Murdoch, that actually local commissioning groups are much better placed to make the decisions about where the money should be spent locally.
Except that locally commissioning groups are largely made up as GPs, and a survey by Rethink Mental Illness has found that they don't feel they have the expertise to do the necessary commissioning.
Right.
The other thing I would say is, obviously services are best locally commissioned with your local providers, the third sector, service users themselves, the public, and in a sense everybody would support that. But there have to be some national standards and principles which no service is free to deviate from. So whether that's access to a bed in a crisis, waiting times, access to psychosis services, you know, if you're young and it's your first episode, and so on and so forth. So there have to be some principles, some bottom lines.
Well, that's why
that
the
are
government would say they've
non-negotiable.
introduced waiting targets.
But-
Those are the principles, those are the bottom lines.
So I agree with what you're saying about the waiting times targets being a good idea, although I don't think there's not enough money to implement what they need because services has been cut so desperately badly in the last few years. I mean, I think since 2012 we've lost about 40% of mental health beds.
Right.
And so, waiting times, what sort of services do you get when you get there is going to be a big problem as well. And I'm incredibly lucky because I had really good support from an early intervention and psychosis service, and it turned my life around. So, you know, now I'm in employment, I'm getting married, things are an awful lot better. But over about half the country, those sort of services is being cut to ribbons. And this doesn't even make economic sense because they save £15 for every pound spent. So, you know, it shouldn't be a decision that, you know, do we have these or do we not? It's such an obvious thing that, of course, there should be excellent early intervention services in every area because this saves lives and it changes lives.
This report today, then, is this a warning to politicians or local commissioning groups or individual NHS trusts? Who?
Well, I think it's a warning to individual NHS trusts to take responsibility for the changes they're making, to make sure that they really understand how they're affecting people's lives. I mean, stories like Kerry motivate us all incredibly, and we do believe our services change lives and save money. I think the one thing that I regret about this Much Welcome report is it really only largely points at trusts, and of course actually there's been a 40% cut in most local authority spending in recent years, and we heard earlier this week there will be even greater cuts to come. Well, some of those services are a vital component of keeping people well and helping us intervene better in relapse. We all have contracts that are year to year. I signed my contracts for my services in October of this year, of this year. When the year began in April, that's a common story because we couldn't actually agree what the funding would be. We need longer term contracts. We need transparency of decision making about the changes. We need greater consensus about the impacts that there will be. I would just like to say one other thing. Many of the new things that are being implemented, so a recovery-focused approach,
What does that mean?
So it means looking at the person's assets. It does mean trying to equip service users together with them in co-production to better understand the pathway of their illness and how to look after themselves better, how to articulate what works for them. Now, that does have an evidence base, and it does in all other aspects of healthcare, actually. The more we understand our health, the more, if we have an illness, we understand what our choices are, often the better the outcomes are for us. But what you can't do is replace evidence-based treatment with more self-care or more peer support. It's both. It's a rich mix
Yes.
of support that's needed to keep people well, get them back to work, get them enjoying life, make them productive members of society. One last point. The average acute hospital, if it invested more in mental health for people who have complex physical conditions, could save, we believe, up to £25 million a year.
Wow.
So it's a saving as
Yeah.
well as a humane thing to do.
So central government is cutting the money, and then the local groups like the CCGs.
Well, central government say they're not cutting the money. They say, you probably know, that they say that health service funding has been ring-fenced and they've provided a little bit more actually for mental health services. But they've also asked the NHS to make efficiency savings.
That's not true at all. They stopped doing the survey which looked at how much money was being spent on mental health services
That's
a year
true.
or two ago. So now we actually don't know anymore what's being spent. So central government are cutting the money, local commissioning groups and so on are having to make the cuts, but they're not responsible for not having enough money to spend in the first place. No one's really taking responsibility, and meanwhile my friends keep dying because they need services that aren't there, and these are avoidable, preventable deaths as young people, and this should not be happening.
Thank you very much, both of you. Thanks for coming on the programme. This is what the Minister responsible for mental health, Alistair Burt, told us. We have given the NHS more money than ever before, with an increase to £11.7 billion last year. And we're introducing access and waiting time targets for the first time. We've made it clear that local NHS services must follow our lead by increasing the amount they spend on mental health and making sure beds are always available.